watching SHEM Ministries, souls honoring Elohim's mandate. And now for today's message.
Well, hello. Welcome to SHEM Ministries. Let me see if I got my little lips right. Whoop, I forgot to check. But guess what? I'm not trying to, it's not about me. It's not about my appearance. It's about the words that are going to come forth out of my mouth. That's what I need you to focus on. Okay. I try, certain appearance, this, that, and the other. But at the end of the day, it is what is being said. It's what is being sown into your spirit, your Noah. The things that you, increasing your understanding. So to God be the glory. This is SHEM Ministries, Souls Honoring Elohim's Mandate. And tonight is my special night that God has given me. It is our SHEM 2 night. It is a spiritual, healthy, enlightening mandate ministry. And this week is an extension of last week in which we talked about to err is human. Yep. To err is human. That none of us are perfect. It is natural to make a mistake. But where I challenge you is, once you make a mistake, strive to never make that mistake again. And if you are blessed to err and it doesn't cause harm, detrimental harm, and we talked about adverse events, and we talked about sentinel events, and I educated you on the difference between an adverse event and a sentinel event. Sentinel events cause serious, irreversible harm that due to an error, okay, that also could lead to death. So we thank God and we praise God. We are going to have a brief word of prayer and go forth. And I'm going to do my very, very best to not backtrack, retract a lot of what was said so that we have the time allotted to move forward. And tonight I want to focus on medication errors. Yep. Because I know, and I did not pull up the statistics, but we know without a shadow of doubt that most of admissions, readmissions, sicknesses are medication errors. You taking something that you thought you knew how to take, and you really never understood it. I've been taking that for 10 years. You've been taking it wrong for 10 years. To God be the glory. This is the year that it caught up with you. Okay? All right. Dear Heavenly Father, we thank you. We praise you. We glorify your name. Thank you for life, health, and strength on today. Thank you, my God, for allowing us to still be in the land of the living. Thank you, my God, for the faculties that we have. We are in our right mind, Lord. Thank you, my God, that I'm not in a vegetative state. Not because of something I've done, but just your grace and your mercy, my God. Oh, we cannot think that we are the reason. No, it is God Almighty who has grace and mercy over us. That's right. I don't care how many times, how many souls you led to God. But the sinful nature of you as a man could be your demise. Lead you to the water, and then you yourself drown. Because you didn't know how to drink. Glory be to God. You were gluttonous and you drank too much I'm just saying, okay? So Father, we thank you and we praise you. Now, Lord, let the words that come forth out of my mouth be a blessing, edification to your people right now. In Jesus' name we pray. Can you believe it is February the 10th? Oh, my goodness, my goodness, my goodness. I remember like yesterday, it was New Year's Eve. Well, Saturday is Valentine's Day. And if you know the history behind Valentine's Day, which now I do, let me just say this. There is nothing today that I emphasize the way I used to. There is no holiday that I put, cray over. Because what I try to do is focus, when they say put God first, if you put God first in every holiday, the way you used to celebrate that holiday will no longer exist. Point blank. So putting God first in Valentine's Day is not a personal, make my heart feel, You know what it is? Telling God thank you for loving me. Telling God thank you for the relationship with my husband that I know you did. Thank you for my children loving me. Thank you for anyone whose path that I may have crossed or encountered, walked away and left me feeling the love of God. Total stranger. But they encountered me and I was able to humble myself and crucify my flesh and let the love of God shine in me and make them feel loved. That's right. So that's my whatever on Valentine's Day. Now, tonight, to Err Is Human, part 2, okay? And let me see. I'm not going to go back through all the statistics and all of the stuff that you and I had gone through on last week. Please review, okay? I am going to, we talked about, yep. We already talked about that. I'm going to put this paper down aside. We talked about the Joint Commission of Accreditation of Health Organizations, that you want the Joint Commission to survey you and say, oh yeah, you are accredited. We want that accreditation. And, but where I want to start now, I want to talk about the errors, and then I want to focus on medication errors, and we want to talk about how to prevent them, right? I told you on last week that you have to take a certain amount of responsibility in your well-being. You do. Well, why should you? Well, guess what? No one makes you go to your doctor's appointments. You willingly go because you want to remain healthy. Is that not so? Is that not the case? So the same willingness, right, to remain healthy, there's nothing wrong with you being willing to make sure that you're getting the right medication, right? Okay. Errors. How do they happen? I'm going to say this. The more cooks in the kitchen, the more potential for there to be errors. When you have one person cooking, they know what they've done. When you have two people cooking, all you have to do is communicate between one another. Do not put salt in that pot. I already added salt. So the meat or the meal or the whatever you're cooking is not oversalted, because what happens? You know how hard it is to fix something that you put too much salt in. It's better to put less than more, right? We all know that. That's a given. But when you have 3 and 4 cooks in the kitchen, how you gonna keep up with that? Especially you trying to prepare a meal and everybody is here and there and no. So too many cooks in the kitchen can be something as simple as too many providers. Okay. What we always called the primary care physician was the gatekeeper. They are the ones who, the traffic, they keep up with the coming and the going of you and where I sent you to urology. I sent you to cardiology. I sent you to nephrology. I sent you to rheumatology. All these ologies, which is the study of, okay? But all that information comes back to me. I am the primary care provider. And because I am the primary care provider, I am the gatekeeper. I keep everything compiled together. Okay? So, number 1, in preventing errors, have you a good gatekeeper. Now, if your gatekeeper is someone that you never see, you keep seeing, let me say it this way. Even if the practice that you go to has multiple primary care physicians in that practice, stick to one, never more than 2. Okay? Remember what I said, 2 cooks in the kitchen. Oh, it's okay, 2 cooks, but multiple? So if you are in a situation, it is best to wait until you can see that provider. And if you can't wait, only see one other person. Then that way you lessen the potential of errors. Now, if your primary care provider has multiple nurse practitioners and physician assistants working with them, do the same thing. If he or she is not available, never see more than 1 or 2. So you have a designated primary care provider. If he or she is not available, you have a designated nurse practitioner or physician assistant. Okay? Okay. It is, unless it's critical, it's worth the wait. It's worth the wait. Why are we so impatient? I'm telling you how errors happen. People are impatient. They don't want to wait. They make demands. And in the long run, you jacked up. Okay? Now, I'm telling you from experience. So that's the gatekeeper. Okay? And the same thing we try to do or should be done in a hospital setting. Most of the time, I know that when I worked in a hospital, I would work no more than 3 nights in a row. So if they did not assign me the same patient, I would ask for the same patients. That's the way it should be. You take care of the same patient. You already know them. They know you. They're comfortable with you. You're comfortable with them. You know their medication. Listen, it's consistency. We mess up when we're frequently I knew this, I knew that, I knew this, I knew that. Okay? Now, we're talking about organization and how things function. Of course, we have our teaching institutions. And there's nothing wrong with that. It used to be where, anyway, lately, they have hospitalists that see patients. And the hospitalists, and this is why they're valuable, because they're on, it's not an easy thing, but many of them are 7 days on, 7 days off. 7 days on, 7 days off, and they get the same patients. And they'll tell you, I'm going to be your provider for 7 days. Continuity of care. It prevents or decreases the potential for errors. Now, in that situation where errors may happen is in the handoff. Something wasn't said, something wasn't told, something didn't get conveyed, okay? So reports like, sometimes we forget to tell someone something, just like, oh shoot, I forgot to tell my husband blah, 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 or I forgot to tell my daughter blah, blah, blah. But now we have smartphones that we can send them a text. So sorry, we can forward it. We can copy and paste and all of that. I mean, but technology is something that you yourself, human you, has to initiate, right? Remember, to err is human. I don't care how smart a computer is. Who programs the computer? Humans. Who entered the information in the computer wrong? Humans. Once we give the information to the computer is so smart. The things that the computer will do. But somebody has to enter the information incorrectly. So, medication errors. Are easily made. Computer induced if the person entering them in did not get them correctly. My recommendation in that instance is when you are a new patient. Okay, so let me tell you, all right, let me go back and say this. Every time we see a doctor or a provider, right? They always send you a link to update your medication list. Sometimes I've been in a hurry too, okay? I ain't got time. Click, click, skip, click yes, next, and didn't catch a potential error. To err is human. How much of the ability for you as a human to correct and fix something was because you yourself chose not to look, read, review, and update. Then you get upset because the doctor made a mistake and gave me the wrong medication, gave me the wrong this, gave me the wrong that. Okay? I'm making these statements, and I'm also thinking clearly of how these things can be fixed by just you, number one, knowing your medications. And that's, like I said, that's where we're going to focus tonight. Okay. But before we go through medications, You gotta understand this too about medicines. Some people know their medicines by the color and the shape of the pill. Well, that can change depending on the drug company and where they purchase them from, especially now if it's a trade drug, it has its trademark on it. Okay? But once the drug goes generic, which is good because it's cheaper, then everybody can put their, if you have the ability to, your drug company to make and manufacture this drug, oh, you in on it, right? And so your company may put their little logo on that drug, but it's the same drug, but a different logo. And if you as a consumer of the medication only knows that drug by a certain shape, certain color, you in trouble, okay? But technology today, and here's my smartphone, okay? I have an app in my phone that I use that gives me pill pictures. And even beyond the app, you can Google your drug and find out what your drug is yourself. Is it time consuming? Yes. How many people say, I ain't got time for that, I'm just going to take the pill? I'm just saying, okay? If you don't know, you don't know, but you got, anyway. All right, so I just want to share that with you, that depending on where the drug is purchased from, the same medication, same dose or strength can have a different appearance. So do not focus on, it's a little white pill. If you knew how many times I've had patients say to me, it's a little white pill. Now, I will also say that many of those little pills have a little number or a letter on the back of them. And unless it's, okay, if you purchase all your medicines from the same pharmacy, right? Many times they will look consistently the same, okay? Even me, myself, as a nurse practitioner, I'm thinking about one time, oh my God, it was at least 15 years ago, where my medication, my thyroid medication, they filled it incorrectly. The pharmacist did not catch the error that the pharmacy tech made between the dosage that I was supposed to be taking and what they gave me in the bottle. How I knew? I started getting sick. I wasn't feeling good. I was gaining weight. I was sluggish. I had no energy, and I am such a very, very, very sensitive person to my Synthroid, my thyroid medication, because I have no metabolism without it, none whatsoever. And that's the reason why I'm very, very, well, today I don't. Because I'm not going to deny that my God can heal me, okay? But today, as of right now, if I stop the medication, I do not do well. So, but by the time the error was caught, it was probably 30 days later, and I was really sick by that time. And anyway, we fixed it, whatever. And so I'm saying that the bottle had the right strength on it, but the medicine on the inside did not. And it took me getting sick to really investigate the pill and realize, oh, they made an error. Okay? But like I said, to err is human. Things happen. If it had not happened to me being in the position that I am very, very adamant about what I teach and tell other people, okay? So I am going to pull this up for you all. At first, last week, okay, remember we had this here to Err Is Human, building a safer health system, okay? And then I had this for you, where we talked about mistakes, close calls, near misses, all of that, incident reports, joint commission, and I introduced to you that there is a root cause analysis. Keep that in mind because we are going to start with that on medication errors. Root cause analysis. And I am now going to, I'm going to get rid of this. Let's get rid of that. Okay, wait a minute. We're going to replace that with that. Okay, you can look at me for a minute while I find, these are the rights that I wanted to go over. I'm not there yet. So root cause analysis is what you do in a root cause analysis. You use the, here it is. You ask these questions. So first of all, I'm going to tell you what is done when there is an error. And then I'm going to tell you how we're going to prevent them. So when you find an error, okay, you need to do this so that you don't just blame. We so good about blaming somebody else for something and not blaming ourselves. Like I said, did you not complete the questionnaire where you were supposed to log in and get prepared for your visit, where you're supposed to go through your med list and all of that stuff, right? Is the root cause analysis of your potential situation because you did not go through. And they even have it where there are diagnoses. I found stuff. I'm like, who put that in my record? I fixed something actually last week or a couple weeks ago when I went to the doctor. They had something in there saying that I had a history of this. And I had to fix it and say, no, I don't have a history of that. I have a family history of this. See? Big difference. Okay? But I understand why they put that in there. And many times it is for reimbursement. And it is what it is. Okay? Everybody got to let me not say that. Sometimes insurance companies will not pay for something unless you prove the necessity. And so sometimes something may be put in your medical record to necessitate or negate the reason for you having that done. Okay? It is all for your good. All right. But the root cause analysis asks at least 5 whys. But at least 5. Now you can do 10 whys, because if after 5 whys you don't get to the root of it, you keep going until you get to the root. Okay. So for example, if a person receives the wrong medication, you say, why did they receive the wrong medication? Well, number 1, the wrong med was in the cup. Why was the wrong med in the cup? The nurse read the order incorrectly. Why did the nurse read the order incorrectly? Because the order was illegible. Why was the order illegible? and so on and so on and so on. Back in the day, everything was paper chart and handwritten. Then we got to computer medication administration records. The computer, you could read. Oh, it was such a blessing. We used to struggle trying to read handwritings, taking off doctor orders because they had arthritis, they had a poor penmanship, and we would have to, I remember times we would go and ask the unit secretaries, the secretaries who take the orders off, you might have to go ask 3-4 different secretaries, what does this say? There were some who were really good at reading Dr. So-and-so's chicken scratch, okay? But then when we went computer, oh, it made it so much better. But then, like I said, the computer is a computer. It doesn't take into consideration certain things if the person who put the order in wrong put the order in wrong. The computer doesn't know. Anyway, it's just whatever, okay? So there are the 5 whys, but if you do not come up with the reason, the root cause of it, you keep asking why until you reach the most fundamental issue in the occurrence of the error. Okay? So I wanted you to understand that before we now specifically talk about medications and those errors. But let me say this. Let me just wait a minute. I wanted to read this right here to you too before we get into that. I'm sorry. Okay, dropped my paper. I had written something down on my chicken scratch before we started. In regards to SHEM 2 and medication errors, God gave me this right before I started. Spiritual, healthy, enlightening mandate ministry. The spiritual part of To Err Is Human is doing what is morally and ethically correct. Okay? Now, business is business, right? On the flip side of it, it was a fee. It was a reimbursement, making some money. Healthcare is a business. If I said it wasn't, I'd be lying. I ain't lying. Okay? It is still a business. And just like any other business, unless you're in a rural area, you can pick and choose which healthcare network you want to be a part of. In our area, we can say, oh, I want to go to Cone, or we want to go to Baptist, which is now Atrium Health, or you want to do Novant, or you want to do UNC healthcare system, which system you want to be a part of. Now, that's right here in our area. Now, I'm going to tell you, in Florida, whoa, oh my gosh. There are so many health networks. And it's almost like, well, let's just tell the truth. Competition. Okay? So, remember what I said about the Joint Commission, this, that, and the other. Different hospital systems have rankings. Yep. And now that as consumers, you pick and choose who you want to go see, It can be in network or out of network, and that's based on your insurance, right? But even within your insurance, they have anyway, all this where you can, if you choose to see a provider out of network, you can. They're not going to tell you you can't. It's just that what percentage they're going to pay for, right? So you still have freedom to do what you want to do. The point I'm trying to make is this. Medication errors and patient satisfaction and all of that weigh into your business. Let me see, your ratings, your Google, how many stars you got, your ratings, all of that kind of stuff per se, right? Give us a good rating. It's the same way with a healthcare system. It's a business. Same thing. So now we have, as a consumer, satisfaction surveys. Every time you go see your doctor, they're going to send you a little link to fill out how satisfied you were. They want you to say, would you choose us again? Would you recommend your loved one to come to us? Would you recommend a friend? Would you recommend us? So the goal is quality care, right? And patient satisfaction. So keep those things in mind as we talk about these medication errors, because if you were involved in a situation where there was a medication error and you got sick and had to be readmitted to the hospital, what you gonna say about that institution? They tried to kill me. They almost killed me. I almost died. Right? Okay, so just keep that in mind as we move forward. And I wanted to read this to you about, let me see. According to the American Medical Association, right? I wanted to talk to you about a term called value-based care. Now, value-based care is the value that you get from the care that you receive. So by definition, value-based care is designed to focus on 5 key goals. Provide the best patient experience, okay? When someone tells you, now this is what I always did, now look. There was always a method to my madness, but it was genuine because it was spiritual, healthy. It was in me to do this. But I always told my patients what I was doing and what I was giving them. Always. My mama can contest to that because I drive her crazy with it. But I didn't give them a cup and not tell them what was in it. I didn't say, here, take your medicine. Oh, no, I did not. I gave them the opportunity, and that's what we're going to do with these when we go through the rights of medication administration. So the best patient experience, you may remember that you had a nurse that told you everything. Or you may say she drove me crazy because she told me more than I wanted to know. But I had a way of doing it where they were satisfied with it, okay? I will tell you, to God be the glory. I give him the praise. I had a lot of excellent patient satisfaction surveys, okay? The negative thing that they said was, I took too long. They were pleased. They were thankful, but it took longer than they thought. Okay, it's the truth. How can you give excellent care and it not take time? It does. So I got to the point where I try to talk faster. Tell them everything they need to know and just tell them a little faster. Okay? All right. But advance health equity, okay? Improve patient health outcomes. That's the main goal now. Is at the end of the day, your length of stay and you were healthy by the time we discharged you and you did not get readmitted. The worst thing is to discharge you and then less than 24 hours or 48 hours later, you readmitted. I forgot what the time frame is. And many times, guess what readmitted you? Medication reconciliations. Okay? Your meds weren't right when you got discharged. Delivery healthcare services at a reasonable cost. Support the well-being of the healthcare workforce. Okay? So value-based care arrangements tie payment amounts for services provided to patients to the results that are delivered, such as quality, equity, and cost of your care. Now, what's the saying? I want what I pay for. I don't mind paying. And I say this all the time. I don't mind paying, but I want what I pay for. Okay? And if you don't pay now, you pay later. So you get cheap, but then you end up having to spend money later because you ended up having to go through this, and this again. I'm just saying. All right, let's move on. I'm trying to decide which one to bring up first. Let's do this, the core 5 rights, and let me get rid of that right there. Now, these are the things that are core to your medications. And the reason I'm taking the time to tell you this, these are the things that nurses are taught. These are the things that anyone who assists you with medications, whether it's even the pharmacists themselves who are filling the prescription, right? Everyone who is professionally involved with your medications are aware and should be aware of this information. Now, I'm telling you this because you, in the back of your mind, it would be good for you to know this and ask questions based on what I'm getting ready to tell you. Number 1, they have to make sure they got the right patient. Verify identity using at least 2 identifiers. Oh, that's why they come in and say, what's your name and your date of birth? Against the order in the patient's ID band. That's right. I don't care what you go to a hospital for now. I don't care even if you go to your doctor's office, they print out labels, right? The little stickers with your name and your date of birth and all of that on them for those reasons. And they hand them to you and tell you to hold on to them as you travel through their clinic, right? So that they can confirm that you are the person with the name and date of birth that signed in with your insurance card, that as you travel through my office, my clinic, I know based on that sticker that you were given that you are who you are. Making sure you're the right patient, the right drug, okay, because we're focusing on medicine. Ensure that the medication name, which includes the generic and the brand name, matches the prescription. Checking for look-alike and sound-alike drugs. Oh my goodness. Oh my goodness. That is a biggie. And in one of the apps that I was mentioning to you, Hippocrates especially, and Hippocrates actually has a free edition. And I think anybody can, I don't know if anybody can, you can download it, but as far as signing in, you may have to be a healthcare professional or tied or linked into healthcare in some way. But you can always Google a drug. That's free. It may not give you all the details and information that Hippocrates may, but you can find out a significant amount of information about a drug just on the internet itself. Okay. But many look alike and sound alike. So you got to be really, really careful. I always tell nurses to spell the drug. And if they have a thick accent or spell, are you saying T as in Tom or are you saying P as in Paul? Right? All right. the right dose. Confirm the prescribed amount is accurate and appropriate for the patient. What do you mean? Well, you don't give XYZ to a baby. You don't give a certain dose of medication to an elderly person. You don't give someone on dialysis a certain drug, or, you have to make sure the right dose is appropriate for the patient. And these, like I said, are nursing considerations, but these are the things that I need you to know that nurses are being taught, and healthcare providers who are even med techs, right? Who are in these assisted living facilities giving out medications. These are things that they're held accountable for, okay? Right route. That's right. Make sure that specific drugs that say do not put in your mouth or your eyes don't go in your mouth or your eyes. Certain medicines are not appropriate. Ointments are not appropriate for the face. You only put them on your behind. Some medicines say do not insert intravaginally for a reason. Do not insert in the rectum. Listen. Because these are mucous membranes and the rate of absorption is multiple times faster than the drug should be absorbed. And if a medication is absorbed too rapidly and the body, it goes to the heart, you can cause heart arrhythmias. If it goes to the brain too fast, we make ourselves sick. Because we are taking things inappropriately. If the drug says only take every 6 hours, okay, we're going to get to that. I'm sorry. Let me get to that. So the right route, administer the specific path that the drug is designed, orally, by mouth, IV, intravenously, topically, only on top of the skin, etc., etc. IM, sub-Q, like insulin, okay? The right route. Now let's get to the right time. Give it at the scheduled time, understanding the drug's pharmacokinetics. So what in the world do I mean by that? Now this is one of the main reason, the right dose and the right time that people are sick today. If the drug says every 12 hours and you take it every 6 hours, guess what happens? The pharmacokinetics of the drug. A drug is broken down by your liver and detoxified by your liver, and it is excreted with your kidneys, okay? So if you don't drink enough water, okay, that's a problem with your renal clearance in your kidneys. If you have liver disease, the dose may have to be adjusted. If you have certain other drugs that shouldn't be mixed with that drug because 2 or 3 of them are heavy liver or reliant on liver function, you can overload something. How do we cause the breaker box to trip in our house? We put too many things in that socket and that wall socket can't handle it. You cause a power surge and your power goes out. Well, in the human body, can you not do the same thing? Can you not overload yourself? Then you get sick, you get toxic, you took too much of the medication and you didn't drink enough water, and all of a sudden there's an outage. You pass out. You sleep and can't wake up. You're lethargic and drowsy. Did you do it to yourself? Because I was hurting and I wanted some more medicine, so I took another pill. You killed yourself. That's called an overdose. Overdose. There are illicit drug overdoses, and then there are prescription drug overdoses. You killed yourself with prescription medications. You made yourself deathly ill and didn't even realize it. I'm telling you. It is very, very, very important that you understand these things. Now, the healthcare provider, now this is an expanded rights. The first five are the five core rights that with any medication administration. Now, below, these are how those rights can be expanded. The right documentation. Record administration immediately after, including details and any patient response. So the job that I have, okay, I get a call all the time from a nurse that tells me, let me tell you something. I spend most of my time doing stuff right here, like this. I do. Patient is sick. They're not responding. The nurse wants to send them to the hospital. And if their vital signs are good, right? They're not, their cardiac output, the heart rate and blood pressure are okay. I don't send them immediately to no hospital. I want to know why I'm sending you. And if I feel that it's a toxic situation that I cannot fix in the facility, yeah, I'll send them out. But most of the time, all they need is some fluid, IV fluid, to flush that medication out of their system. Yes, that is mostly what is done. And I tell the family, give me 24 hours to turn them around. Give me 2 hours to get, some fluid in them and see if they don't start responding. And so many times the nurse will call me back by that morning and say, I'm so thankful I listened to you because I can't believe it's like night and day. They woke up and they're back to their normal self. And I say, do not give that medication at the same time as the other drug. Okay? It's teaching and educating the nurse who her task is to get the medications given. And she doesn't necessarily understand everything. You know why? Well, one reason why. They have 20 and 30 patients. It's not an excuse, but I understand that. I've been there before. But to err is human. And you have to morally and ethically take your time, even though if all the nurses are sitting down at the desk and you still pushing your med cart. Do what you got to do. You got to live with it. Okay? Right education. Inform the... is that not what I told you I did? I sure did. Inform the patient about the drug, its purpose, side effects, and how to take it. Right to refuse. Patients have the right to refuse medication, which must be documented and communicated. You explain to them what it's for, and some medications cannot be abruptly discontinued, right? It can hurt you more to miss a dose, like refusing to take your insulin. Stuff like that, right? I'm just saying. But they do have that right. Right assessment. Conduct assessments before and after administration. Now, these are nursing specific things. Now, if you are a caregiver in the home and you're the one administering these medications, you should observe the person before and after. You do not have to be a licensed professional if you are functioning in that role in the home. You're the caregiver. You take on that role. Okay? Because guess what? There's not enough beds in a hospital. There are not. There's not enough nursing homes. There's not enough, and who can afford them? Huh? And a quality nursing home where they're adequately staffed is not cheap. I'm just telling you what I know. So, right reason and indication. Understand why the medication is being given for the right reason. Is this my blood pressure pill or my heart pill? Or is it both? Is this the medication that they give me to keep me from having blood clots because my blood is so thick and I've had a blood clot before? Is my blood thick because physiologically my blood vessels or the cholesterol or there's so many reasons that a person can be in a hypercoagulable state. Hypercoagulable means that you're at risk of producing blood clots or emboli that can cause a stroke or can cause a heart attack. You can have trauma, a traumatic injury to the tissue, and it sloughs off and forms scar tissue that blocks blood flow. There's so many reasons. Do not assume you know what you need to know about something. Make sure that you know what you know, that you know that you know. And if you're not sure, guess what? There are people such as myself. Now this, I'm going to do the last one, and then I'm going to put a plug in for Ask Anna, okay? Right to know. Be informed about potential interactions. That is major as well. 2 drugs prescribed for you, good for you, are taken together and have an adverse effect. Okay? I'm going to tell you about me. Okay? Now, we talked about the thyroid disease. Do you know how many years it took me to realize that? Because stress, working, hyper, blah, 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 blah. I had a hyper secretory state where acid production, GI tract, right? I was producing more acid and I had acid reflux. So I was like, oh, no big deal. I'm going to take some Pepsid or Protonix or an antacid, because the cheapest antacid is Tums, right? Calcium carbonate. Take you some Tums. But guess what? Calcium is a mineral that binds with my thyroid medicine. Also, my thyroid medicine has to be taken on an empty stomach because of the pH of your tummy without food. So it's a lower pH. But once you eat, what does eating do? Eating causes acid to be produced so that the acid can break down the food. But that's not good for absorption of the thyroid medication, right? And at that time, they didn't always put those side effects on the pill bottle. See, I've had thyroid disease for 30 some years. I'm telling you, because I am always transparent, I'm telling you how myself, as a healthcare provider, the things that I went through and had to learn the hard way. Everything known about that drug is not given or known at its initiation. Remember the talk that we did on drug research? And I told you that a drug may get FDA approved after blah, 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 but that the research and everything known about the drug continues for years and years and years. So it was not disclosed, or it was unknown that that medication taken within 4 hours of this would cause that. So anyway, I learned the hard way. I could not take a antacid until at least 4 hours. I could not take a multivitamin that had minerals in it until 4 hours after I took the medication. I had to take my thyroid medicine on an empty stomach, and I had to wait 30 minutes to an hour before I could eat. So what I ended up doing, and this is what I do today, and I'm just talking about me. I wake up an hour early before time to get up. Okay? Take my thyroid medicine with 8 ounces of water at least. Keep a bottle of water on my nightstand. Why do I do 8 ounces of water? Because I need the medicine to break down well and get down to my kidneys. I need the medicine to get into my bloodstream like it needs to be before I eat. So I would do that. And any vitamin or mineral or anything like that, I would take at night. I would deliberately wait. If I was having a kind of acid type thing, I definitely would not eat or do anything that would cause increased acid production until hours afterwards. I'm just telling you. But if you don't know this about the medication, so guess what now? On the bottle it says, it'll tell you this medication must be taken on an empty stomach. The literature that they give out says do not take blah, 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 blah. Okay? So that is my part 2 to Err Is Human. Okay? I need you to know no error is intentional. It's not intentional. Okay, now I do know that there are some, the nurse that was killing people by giving them overdoses of insulin. Now that was a psychotic, that was a whatever. But most errors are not intentional. That's the reason why every encounter, go through your medicines, know what you're taking and know why. I tell God thank you that I personally have a love for teaching and teaching people about things such as that. And I've done it for years and don't mind. Okay. But guess what? Let's be for real. Time is money. Okay. There's so many things going on in this world today that do you really have time to do all of that? Not really. I thought I had a slide up here for Ask Anna. Oh, shoot. I guess I don't. I don't know what happened to it. Let me see if I can find it. But I do have a business called Ask Anna, and I would be more than happy to assist you. If you see a need for this type of teaching and instruction, for me to go through your medications with you, for me to, and I'm looking for my business card on my slide. I know I had it somewhere. I don't know how I misplaced it, but here's one. And yep. Hold on a minute. I'm getting ready to upload it for you. And okay, hold on. Done. Okay, and then let me get the other side of it. Oh shoot, it's gonna make me go all the way down again. I'm gonna get the front of my card. Okay. So this is my business card. I'm gonna read it to you, and if you need Everyone may not need my services, but if you do, here we go. Ask Anna, PLLC, Medical Consulting. Our goal is to help you understand what your physician is actually saying. Now, whatever is needed, I'm available. However, the thing that I would love to help you with the most is understanding your medications. And here, this is my number, 336-355-6472. And I have a Gmail. I do have a website that my goal is to have completed this year. That is my goal for this year, is to get my website up and running. And the two scriptures that I practice and honor that God has given me, Proverbs 4:7. With all thy getting understanding. Now, the back of my card, let me show you that, okay? And I am, at the time that the business was incorporated, my initials were ASK, Dr. Anna Shaw Kirk. I am Dr. Anna Shaw Devlin now, but still, same old person, same old social security number, date of birth, all of that stuff follows me. I am who I am. But Hosea 4:6, my people are destroyed for a lack of knowledge. Okay, so there you go. All right. God bless each and every one. Thank you for tuning in tonight. Thank you for staying with us. Okay, but to err is human. To God be the glory. Let's focus on our contribution to the things that hurt us the most. That's the easiest to prevent. Medication errors. Know what you're taking, the what, when, how, why, all of that. Write the information down. I actually recommend that you enter it into your smartphone. Your medication list. Have a list. And all the details if you need to. The generic name, the trade name, the concentration. If it says 100 milligrams per whatever, put it down. And then take 1 cc or 10 milligrams or 1.5 tabs, and it'll tell you daily, twice a day, 3 times a day, 4 times a day. Put it down. Okay? And then if you don't know what the drug is, Google, what is this drug for? And write it down. Or actually read the information that came with it. Okay? And do know that one drug, for example, can treat multiple different things. Cymbalta is one. Cymbalta duloxetine is a drug that can treat neuropathic pain, nerve pain, depression. There's multiple things that one drug can treat. Okay? That's just one drug. So just because it may say whatever, make sure that you could be taking it for another reason. Make sure you ask your doctor and say, why am I taking this? Am I taking it for my heart? Or am I taking it for my blood pressure? Why am I taking this? Get them to be specific with you. Remember, the PCP, primary care physician, is your gatekeeper. All right. All right. God bless you. We love you. I hope you have a blessed rest of your night, restful night's sleep, and keep us in mind when you need education, medication administration. I was teasing. I was thinking about my husband and his keep us in mind when you need that shine. I got to find me something. All right. Love you all. God bless. Bye-bye.